Hi everyone, it's Dr. Stephen Lin here, and we're going to have a live Q&A about craniofacial growth and development. So I'm just going to wait for a second to see if we're connected. If anyone's seeing this broadcast, can you just send me a message, send me a hello, and tell me where you're tuning in from. Just line this up a little bit. Okay, all right, that's a bit better. Okay. So we're about to talk about have a Q&A on craniofacial growth and development. Hi Narissa, how are you? Thank you for tuning in today. And so there was a lot of questions in the community. Can everyone hear me okay? I just wanted to check that the audio and everything's all right. Sometimes it's hard to tell with these things. Oh, Melissa's tuning in from San Francisco. Hi Melissa. Yes, so we are, yesterday we made a post on the, thanks Kayla, okay, sounds good, so the audio is good. So yesterday we had a post talking about craniofacial growth and development and the quite alarming comparison between modern skulls and what we're seeing today in our children's teeth, in our own teeth. And this has been particularly, oh, thanks Marie, thanks Wendy. Yeah, okay, looks like we're good now. Yeah, so everyone that's in, if you just want to tell us where you're logging in from, and if you want to put a question in the comments, please do now, and we'll try and cover them over the period. But so generally, we're talking about craniofacial growth and development. This has been a passion of mine for quite a while now because I see it in my patients all the time, and I've been trying to work out, how to get this message out there that, crooked teeth is one of the biggest health problems on the planet, and not one of the biggest health problems. It is the biggest health problem, and a lot of the focus of my clinic. Marie's there in Byron Bay. Oh, it must be lovely up there. I'm hoping to visit up there soon. So one of the focuses of my clinic is to really address this problem, and that. To get out to the community that crooked teeth can be prevented if we know how. And so if we look at that, at the picture that we see in on the post that we made yesterday, you see an ancestral skull. Oh, we've got a few more. Savannah G. Oh wow, and Terrigal just down the road. Great to see you guys. So when you look at the pictures of an ancestral skull compared to a modern skull, which is what we're looking at, bones and teeth, you see that they have shrunk, and that's why kids need braces today. It's a huge health problem, and a lot of the questions that people are asking is that, how do we address this? How do we stop this? Oh, hi guys, hi from Newcastle, New Zealand. There's a few more tuning in there. Yeah, so. Look, if you have a question in particular, please post them in the comments. Otherwise, we're going to address them. There's a few here that I've recorded. But so basically, we're talking about how can we prevent braces in kids, or what can we do about crooked teeth and the sequelae of crooked teeth, which are many. And so there was a post that you might have seen this morning that the numbers now say that we have 1 billion people on the planet, and that's recorded. So the actual numbers of people with sleep apnea are far higher than that, and there are ranges of sleep apnea, and so they're only the severe end. And so what we're recording is over 1 billion people have the severe form of sleep apnea, and this is all a craniofacial issue. Okay, so Marie's asked, how do I find a dentist that want to do this work? So that's a good question. It's actually on point to what we're talking about, because when the jaw doesn't grow correctly, one of the big problems we have, there's many problems, but one of the big problems is that the airway is difficult to maintain when we sleep, because if you think of the jaws as the structure of your airway and maintaining the structure of your airway, when you sleep, it actually collapses, and that's what sleep apnea is. Sleep apnea is a collapse of the airway. It's quite frightening for people that describe it, or if they watch a loved one that snores and then pauses in their sleep, which is actually how they diagnose an acute respiratory event, is actually when someone pauses in their sleep. And so people can pause for up to 30 seconds to a minute And this is quite terrifying because, you know, we're watching people choke in their sleep. And the core problem is craniofacial issue. And so Marie has asked, how do you find a dentist that works in this field? And sleep apnea is actually one of the easier modalities that you can find. Functional dentistry has many different arms. So it's a term that I've founded in a way because it's using the principles of functional medicine, so root cause, understanding conditions and how the body is connected. But we use dental. Oh, hi, Natalie. Thanks very much. Oh, we got someone tuning in from Silicon Valley. So we're just talking about how to find dentists that work in this field. And so because the question is that when our craniofacial system doesn't grow correctly, we suffer the consequences. And so with those billion people with sleep apnea, there are a lot of dentists out there that diagnose and treat this. And so if you look at the way that we treat sleep apnea, the main recommendation that people will get is that they'll be put on a CPAP machine if they're diagnosed with obstructive sleep apnea. Now, that's a machine that pumps air literally down your throat when you sleep. And so whilst that is a solution for severe people, to avoid the complications of sleep apnea, because the complications of sleep apnea are significant. We're talking about heart attack, stroke, and then down the line, Alzheimer's disease, dementia, because the brain is starved of oxygen and the brain actually loses its ability to manage blood pressure. So there is a big population of dentists out there that actually treat sleep apnea. And so what you should ask is that, or you should Google when you're looking for a dentist, you should see if they have any sleep-related information on their website, or you ask office, do they have sleep modalities? And that will show you that they've done some kind of either furthering education, or they have different techniques to work with sleep apnea. And it shows that they're switched on to this idea of the mouth being the portal of the airway. Now, there are many arms of functional dentistry, but there are the easiest to find out there are dentists that work with sleep apnea. And it's critically important, actually, because it's very difficult to treat sleep apnea without having a dental perspective, because if you're the only option you'll get is a CPAP machine. But the way that the message that Crooked Teeth teach us is that the function of the mouth and how we use the tongue and how we breathe through the nose is how the jaw develops, and then how we and ultimately how our kids develop later. So we just had a question pop up about how do we avoid craniofacial growth in kids. I'll just go up a little bit. Let's go back. Let's work back from the problem. So we've talked about sleep apnea, and we've talked about finding a dentist, which is very important if you have a family member or you have sleep apnea or you suspect you have sleep apnea. And this next question actually relates to that. So Shay Smith from Boston says, I have TMJ and I grind my teeth in the sense that I clench them tight and wearing down my teeth with lots of tension. Okay, so this is a symptom of a potential breathing issue. And so in the literature, we find that a big complication of sleep breathing issues is clenching the teeth. And so one possibility is that the brain is actually designed to pull the jaw forward because it's trying to open the airway. And that's what a lot of the time they find that bruxism is. So when you're bruxing, is actually your brain telling you that the airway is closing because there's pressure sensors all through the nasal and oropharyngeal airways, and your brain detects that. And so I'm just going to show that. So, okay, great. So we can pop the questions up on the screen. And so what happens is that when you grind your teeth, it's actually your brain telling you at night that your airway is closed. When those pressure sensors detect more pressure, they panic, and your brain panics and is pushed into sympathetic flight or fight syndrome. And that's the autonomic nervous system that should be in parasympathetic rest and digest, but it's actually been pushed into sympathetic drive. And this is fight or flight. It's not the neurological pattern that you want to be in when you sleep. One of the easiest ways, this is the first thing a sleep focused functional dentist will look at, is whether you grind your teeth. And so we have a question here based on people that grind their teeth. They often get jaw issues. So you'll get either a click in the jaw, you'll get a sore jaw, or you get one-sided migraines. There's or even you can have a popping of the jaw, and that's a symptom potentially that you're grinding your teeth at night. Now, for the most part, the grinding of the teeth is a symptom of the airway issue. And so what you need to look at is, you probably have an undiagnosed form of sleep apnea. Now, to put this into perspective, we know that there's 1 billion people on the planet that have sleep apnea. And then there's all the peripheral people that have the undiagnosed versions. And this is called upper airway resistance syndrome. And it's a syndrome that goes alongside with teeth grinding. So Shay Smith, you probably have a version of upper airway resistance syndrome that you will probably, it's best to see, you can either get a sleep study or you can see a dentist that looks at this. And so what they need to do is they need to find where the restriction in your airway is. So for instance, if you have an issue, if you have a deviated septum, or you have nasopharyngeal issues, or you have tonsil or adenoid issues, then the restriction is up here, and this is a nasopharyngeal restriction. But for people, this is most people, if you don't use your tongue correctly and you don't tell your body to breathe through the nose at night, or through the day, sorry, because that translates to your nighttime breathing, then you will actually probably be mouth breathing at night. So one of the things I really suspect when I look at patients that grind their teeth is I do suspect mouth breathing. And one of the simplest things you can start to do is to begin to start to learn to breathe through the nose. Now, it's not easy. I went through this process myself. I felt a few years ago, I felt I was on the road to developing sleep apnea, because I was having a kind of a deeper snore from the back of the nose, which is very common in Asian ethnicities, because the maxilla is often a bit flatter and set back. People have different types of jaw malocclusions. But so in my subset, I'm a risk factor for this nasopharyngeal pressure at the back here. And so what happened was that I wasn't sleeping very well, and I was actually treating patients for all this stuff, but then I realized it was happening to me. And what I had to do was I was retraining myself to breathe through the nose. And so that's tongue position, because tongue muscles support the neck, all the muscles through the neck, the base of the skull. So you really have to learn to lift the tongue to the roof of the mouth. And that's right to the back of the soft palate, because, and we'll go into this in much more detail at a later point, but the tongue is such a complex organ. If you're not using it correctly, you're not using it correctly when you sleep, and your airways are literally collapsing. When your tongue is up, and this is the back of your tongue, if you imagine the back of your tongue, so if you put your finger up to the roof of your mouth and slide to the back and feel that soft palate, your tongue should really sit and connect against the soft palate. And the only way that happens is if your shoulders are back, if your cervical spine is straight, and your rhomboids, which is the back muscles in between your shoulder blades, are turned on, and you have very straight posture. This is why posture and the tongue is connected to how you breathe, how you sleep. So that posture and that tongue supporting that cervical spine opens up the airway. Your airway is nice and wide. That's how you train your muscles to breathe when you sleep. So all of this is usually connected. So if you have TMJ, it's usually a sign that your jaw's a bit off, or your head's pointing to one direction, because your posture's off. So it's all connected to the tongue. You have to support the cervical spine with your tongue posture. And that's when you swallow. Every time you swallow, it should be a reconnection. I'm going to go into more detail of this in future videos, but Shay, if that's just kind of a bit of an introduction to that, is that there's a breathing and a tongue posture connection to why you grind your teeth, and why your joint is a little bit out, and why that can potentially lead to later on sleep apnea. So it's great that you've picked that up, and that you certainly don't want to be damaging your teeth in the future, but we really want to be making sure that So there's a question here, I think, were you assessed for ankylosis? So Shay, so guys, if you can interact with each other in the comments, it's great, because there's usually a lot of professionals here listening and interacting. So there's lots of people with lots of nuggets of information. Okay. How do we encourage mandible growth? That's a good question, actually. So, so what Lyndall is referring to is the mandible. So the mandible, which is at the lower jaw. And so one type of, so if you think back to the picture that we posted yesterday of that, we were looking at the upper jaw. And so the upper jaw is the center of the craniofacial system. And what happens is that everything centers around what's happening here. And if the upper jaw widens, then the rest of the face follows. So all the muscles actually follow, and the lower jaw follows. So the lower jaw is actually will grow and develop in response to the upper jaw. Everything is central to what's happening with the maxilla, and the reason for that is because craniofacially it actually connects back to the sphenoid bone, which is the centerpiece of the craniofacial system. So when you and that's how the jaw develops, and it bases your nasal sinus. So the things that affect your maxillar growth is nasal breathing. So every time you breathe, that pulsation of the maxilla actually helps it to grow and expand. So mandible growth is actually connected to how your maxilla grows. So if you have there's different types of this. So I'm going to post more about this in the future. But so the way you functionally diagnose a malocclusion is you look at the relation of the teeth, you look at the relation of the jaws, and one aspect that Lyndall is referring to here is that the mandible is back. And so some kids and some people have their jaw that sits back in what's called a class 2 orthodontic relationship, where the lower teeth are set back further. And she's saying, how do we correct this? Well, a lot of that is posturing. So one thing is that we certainly need the maxilla to be in good relationships. So sometimes we would expand the maxilla, but the way that you do it yourself is to teach the tongue to go to the roof of the mouth, because remember that the mandible is like a tent for the tongue. So all of the muscles slay off the mandible. So when the tongue is up and out, the mandible is forward. So when you're positioning the tongue to the roof of the mouth in this suctioning motion, the mandible is told to come forward. And when you're swallowing up and back, the mandible is coming back. And a lot of people suffer now is they suffer from actually using the facial muscles to swallow. So you'll do these pinching swallows, and that's using the incorrect muscular pattern for using your oropharyngeal swallowing pattern. So for the muscles of the face are run by the facial nerve, a different cranial nerve, to the muscles of the tongue, which is run by the hypoglossal nerve. And then the muscles of the jaw are run by the trigeminal nerve, which is the three-pronged nerve that goes to the eyes, nasopharyngeal area, and the mouth and all the teeth. It's a huge cranial nerve and really interesting area, the cranial nerves. But when you use the incorrect muscle group, you get the incorrect pattern, and your airway doesn't function the way it should. So mandible growth, it's all tongue posture and lip sealing. So learning to seal the lips. So one, open lip posture is a big factor in a retrusive mandible. So mandibles are set back here. So lip posture and tongue seal to roof of the mouth are the simplest way to do it. Sometimes there can be widening devices that we can use in a myofunctional approach to malocclusion. Okay, so let's see. We've got a few more questions here, and then I'll jump into the ones that we had recorded. Okay, so these kind of run into each other. So I'll do these in order. Do you assess, Melissa Gore has asked, do you assess jaw development in children in a regular checkup? Hi, Melissa, thanks for joining us. Yes, absolutely. This is nearly the primary thing I'm looking at. If I'm honest, like the teeth don't actually really, kids' teeth don't really bother me that much, because one, if we get the diet right, they're going to usually manage themselves, but two, they're going to fall out. And so I'm looking at their jaw. So we're looking at how the relationship and the space for those adult teeth when they come in, because the critical age group is between 7 and 12. Now, a lot of previously we've been told that orthodontic work should kind of wait, and orthodontics is one of the best ways that you can drag teeth and get a straight looking smile. But when we're talking about jaw development, we need to get in there earlier, because between 7 and 12 we have this crucial growth period. And actually, next time we do a live, I'll have an OPG, because between 7 and 12 what we do is we take a full mouth X-ray and we take the scans and whatnot to look at the adult teeth, all the development, and it's amazing to see how many teeth are actually positioning in a child's jaw, waiting to come in, and you can spot whether they're a risk of, for instance, a tooth being impacted. A common impaction is the canine teeth at about age 12, so that should be the final teeth that come into the adult dentition for most kids, and they can get stuck there because there's no space, and that's a lack of expansion and forward growth of the maxilla and sometimes the mandible too. But so you can spot these things early. So do I assess jaw development in regular? Absolutely. That's the one thing I'm concerned about, because one, we need to know whether they're sleeping and breathing at night, because their jaw will determine whether they sleep correctly and whether they're oxygenating their brain and breathing correctly. And two, there is an opportunity potentially to prevent braces, and kids are very malleable. Myofunctional orthodontics is all about preventing braces and how do we avoid these craniofacial growth issues, which is, there's a question here that we're going to go lead into next. So this is absolutely the primary thing that I'm looking at. Like I said, I'm not so worried about looking at kids' teeth and their, because it's a much lesser problem. Dentistry really teaches you to be focused on the things that matter, and when you think functionally, you're seeing the things that are really if you can prevent braces in a kid, it's going to impact their whole life. You think about their risk of sleep apnea later on. So it's very, very much at the forefront of my mind in practice. Okay, so Thu Chiong has said, how to avoid craniofacial growth issues in kids? Okay, so that's a huge question. But look, let's kind of take a meta view of it and like go from right from conception. So originally, so when Weston Price went around the world and found that traditional cultures were growing these beautiful craniofacial structures, nice straight dental arches with wisdom teeth, by the way. Wisdom teeth, aren't supposed to get impacted, and in the anthropological record they don't. And so in the record we see 32 human teeth nice and straight around the dental arches. And so what he found that was the traditional cultures were based in these eating patterns that would grow a baby with a nice round head. And so the way they would assess whether the couple had, or the baby was healthy, was that, oh, the baby's got a nice round head. And that's talking about craniofacial growth, right? Because if you look at children today, you'll see narrow faces, and you'll see, especially in babies too, the mandibles are very set back. Now there's two pediatric dentists and an orthodontist that work in the anthropology section at Penn U, and they show that babies today, the mandibles, of ancestral skulls of newborns were far more forward than they are today. Today, the mandibles, they're just not. They're very set back in the retrudative form, as we were talking about in the previous question. And I think we're not developing in utero, and so that's a big thing in that. But basically, if the child isn't getting nutrients, if the mother has sleep apnea or any sleep, so if the mother has craniofacial issues, then the child will likely, because there's going to be restricted oxygen to the fetus. So in utero, this is all happening. So on a population view, we need to start understanding this far, far earlier than what we are now. So it's great we're having this conversation, but the problem goes very deep into how our genes form and how our body takes in messages from the environment to grow and develop. So Price found that cultures would actually eat a diet rich in fat-soluble vitamins for 6 to 12 months before conceiving. Before they wanted to conceive, they ate these foods. So that means that the nutrients that drive craniofacial growth and development, so vitamin D, vitamin A, vitamin K2, magnesium, they were stacked into their diet. And so a pregnant woman would be built up with these nutrients, so that her body is raring to go to build a child. Now, in the dental practice today, I see mothers that have had a few kids, and you can see their teeth and their gums and their bodies depleted, and they say this, I feel depleted, because it comes out of you. Where do you think the skeletal system of a child is taken from? It's taken from your own stores. And so we really have to start being much more mindful of how our mothers are looking after their own body and physiology, because that's what's being passed to our kids. And I don't think there's enough education on prenatal nutrition and how important this is, especially even when you're breastfeeding. This is constantly coming out of you. So how do we avoid great craniofacial growth in kids? We need to retune our appreciation of how the growth and development of a human to start with. Breastfeeding, we've talked about breastfeeding. Breastfeeding is important. Nutrition during breastfeeding is very important. These nutrients are very, so there's some recommendations that breastfeeding causes tooth decay. Well, we really need to be understanding the constitution of that breast milk, and we know that vitamin D deficiency in a mother will transfer into a milk and into the child. So there it is, straight there, that a vitamin D deficient mother will be passing vitamin D deficient milk to a child. So, and then we know the connection there to tooth decay. So there really is a need to understand prenatal nursing nutrition, and then so from the newborn, they're growing, developing right from that start. So if they're getting that milk, if they have to have formula, it should be a formula considered around these nutrients. However, breast milk is best, and it certainly helps the growth of the craniofacial system, the tongue sealing to the roof of the mouth, the nasal breathing during breastfeeding. There is no better way to design it than what nature did. And then from there, so getting the kids to breathe through their nose from an early age is really important. So my kids, you have to teach them to seal the lips. And if you see them with mouth open posture, you have to really teach them to start sealing those lips, and to begin breathing through the nose, because it becomes a habit. If you breathe through the mouth, that's what your brain becomes used to, and that's what you do. One great thing in kids, babies learn it very quickly, is tongue clicking. So you do that with a baby, and they'll watch you, and then they'll do it. And so they'll do it by 5 or 6 months. They'll do that click, and that's you teaching them to put the tongue to the roof of the mouth. And then I see my son do it a lot. I see him suctioning the tongue to the roof of the mouth, because he's seen it, and he's seen us do it. So exercise and oromotor function is very important for parents you have to teach them to do it, because if they're not taught it, then they just they'll go to what their resting posture leads them to. Then, so as we get into this 7 to 12 age, then we're starting to get into so look, what we also have to recalibrate is this is a deep set problem. This is now 2 or 3 generations into this issue. So we're going to spend 2 or 3 generations correcting it. So one thing that I do with parents, don't panic. If we can diagnose it early, and especially in the earlier stages, if you're noticing these signals in your 3, 4, 5, 6-year-old, yes, it's an issue, but you've got plenty of time. The fact that you've identified it, it tells me that you're going to be doing a lot of things to correct this. So the first thing is, don't panic. There's time. And look, the other thing too is that parents with adolescents with these jaws and breathing issues and craniofacial growth issues, it can be corrected in adolescents too. It's much slower, but and it can be corrected in adults as well. But it's much harder once we get to these older age groups. So in kids, they need to be eating these nutrients. They need to be eating fat-soluble vitamins all the time. I put cod liver oil into my son's milk every morning, and he drinks it. And then that's what he'll drink for as he's growing up. And his bones are as strong as his head is like a rock, because I can feel that his skeletal system is developing the way it should, because he's had the correct fat-soluble vitamins. Yeah, I know that he doesn't have any decay, because I know his body has had the nutrients. He's never had fruit either, which you don't necessarily. Everyone doesn't have to do that, but because we live in a society that's kind of we're kind of showered in sweet things. We've kind of just not had him had any kind of sweet in his first 2. He's turning 2. He will, but when you can control it, because once they go to school, obviously that can't control it. So the diet's really important. They have to, eat fat-soluble vitamins. You can put desiccated liver into their food, into their sauces. You have to get into their system because they're hungry little growing systems, and their skeletal system really, really needs those nutrients. So organ meats, my son eats an omelet every day, different types. I usually put some shaved carrot and bone broth in some powdered bone broth. I put into with cream. So that's generally what he eats every morning. And so he eats a very high fat, high nutrient diet. And so it's critically important that if parents know this, kids will recorrect that. So the craniofacial system will start to grow, because remembering that we know that vitamin D deficiency affects bone growth in the skeletal system. It also affects the craniofacial system as well. That's one huge misconception we need to really turn over, is that deficiency in these nutrients, yes, they cause osteoporosis later in life, but earlier in life, they're affecting the growth of these jaw bones. That's one big thing that I hope everyone takes from this, is that craniofacial growth is a malleable system that's listening to our environment, how we eat, breathe, and so forth. Then, so if there's an issue, there is an arm of functional dentistry called Myofunctional orthodontics that can prevent braces. So between 7 and 12, and even earlier, you can have fixed expanders, you can have removable expanders. There's systems that teach them to breathe through the nose at night. They wear the guards and they breathe through the nose. There's lots of different myofunctionally based orthodontic systems, and they're preventative in their philosophy. It's that, once you put braces on, you're just dragging teeth, but that's fine. That's the best way to align teeth. But if we were looking at it from a preventative sense, we're looking to expand, looking to correct function. So you expand, and then you teach them to put the tongue to the roof of the mouth, and the palate and the jaw will change themselves. It's remarkable. I'm hoping to publish our cases in the clinic here in the not too distant future, of kids that have expanded their jaw and prevented braces. And in saying that too, this isn't an easy problem. If you think of a skeletal system, fixing a skeletal system, it's not an easy problem. So there's lots of different modalities. We have to talk to the ENTs, we have to talk to the sleep specialists, we have to talk to the body workers, the craniosacral therapists, the osteopaths, the chiropractors. They help fix the posture, because the posture is important. Lots of kids are like this these days, on their phones. That affects the growth of their jaws, because they're not using the muscles and the tongue support to support the cervical spine. So this is all melded together. This is how we fix craniofacial growth develop. We take a whole body view, from birth to nutrition to posture to breathing to sleep. It all connects to how we grow and develop, and how our kids grow and develop. And I really think that adults need to learn and embody this, because if the kids see an adult population doing this, then it becomes ingrained in them. So I think the first step is for adults to learn this, and for adults to understand this stuff, and then they can teach it to the kids. If you teach it to a kid, it just happens without any intervention. Isn't that amazing? Okay, so let's go to question. Okay, we've got a lot of questions here. Let's talk about the specific. Okay. So Naomi Strobel says, so if the maxilla is not expanding and large front teeth coming in at an angle, what kind of orthodontics do you recommend? I've seen 2 systems in the use to help start and one other. Do you have a system you recommend? Look, the real, there's a lot. So Healthy Start's great. Yeah, so I think Sandra Khan and Simon Wong, I think, developed that, and they're great. They're excellent myofunctional systems. Any orthodontic system is going to work correctly in the right practitioners. So I use a mix of systems. I don't think there's any right system, but you really need to just talk to your practitioner and just about their philosophy. And you have to remember too, these are guiding systems. So you're not going to, you have to go with it, and the system really needs to be, so a lot of these systems require a lot of interaction with the kids. So it's a commitment from your child to interact with them, to wear the devices, to do the exercise. Healthy Start has, an exercise system. You have to do it, and a lot of these systems do. And it's not easy. Like our cases, like our myofunctional ortho cases, it's not an easy program. And I remember going to visit Mike Mew in the UK and looking at his, and that's what he says. He goes, this stuff is not easy. He uses a 3-piece expander system. So look, so if you're expanding the maxilla, any they need to be diagnosed on where their restriction is. So they'll either expand in horizontally or both horizontally and anterior posterior, which is this way. And so it's just a question as to what your child's dysfunction is. So is it tongue function? So usually there's a tongue thrust that's stopping the front teeth coming down, or there's an undeveloped maxilla, or the mandible. The mandible is retrusive, as we've talked about. There's lots of different ways. You need the correct diagnosis, and then it's going to be commitment and the right practitioner that you feel comfortable with. And you guys will just be talking every time you go in. Everyone is kind of knows that we're watching the kid grow and develop it. There's not one system answer, but you have to be obviously comfortable with with the approach. So how common are spinal issues, e.g. scoliosis, in these kiddos with these structural features? Chiropractor from California. Yeah, there's some really interesting rat studies that show that when you correct the jaw, you'll actually correct the straightness of the spine. So what often happens is that the jaw is actually connected to obviously the spine. So when you have what I've found in kids especially is that the way they breathe and the way they posture their cervical spine and their shoulders is all based around their tongue. So the tongue and the cervical spine, the jaw, any T&J issues, it's all centered around the tongue and breathing. And so the spine, really, to my observation, and I love to work with chiropractors and body workers because this is all connected. The relationship of the jaw. So Melissa, if you have, for instance, if you have a maxilla that's stuck behind the mandible, you'll see this pattern that you won't be able to do anything to the spine because they'll constantly go for their body work and they'll go back because the jaw is stuck in and it's called a crossbite when the kids or the adults upper teeth are sitting behind their lower teeth, and that's a really hard skeletal issue. So if you look at their bite and if their upper teeth are behind there, that's one of the easiest ways you can diagnose a jaw system that's heavily out. All right, so we have. Okay, I'm just going to grab some more questions. Okay, so this is a little bit off the topic. Look, that's a bit difficult. Let's stick to craniofacial growth. Okay, so Ruta detail. Hi, Ruta. Can you tell which child breastfed and bottle fed when you see the jaw of a child? That's a great question. And actually, it's not that simple because, so we've touched a little bit on it in this video, but the breastfed kids are still experiencing malocclusions today or craniofacial growth issues. And that, I think it really speaks to the fact that if the mother is deficient in these nutrients, so if we dive back into how these why the craniofacial system isn't developing, remember that Price found that once we eat the modern diet and once we have a system devoid in fat soluble nutrients, that's when everything starts to shrink. Vitamin D physiology tells us that exactly. So for instance, vitamin D is connected to the growth hormone system. So growth hormone is what your body, and it's connected to insulin-like growth factor. Vitamin D, growth hormone, and insulin-like growth factor are all connected. So the messages for your child for a child to grow is based on the levels of these vitamin D and all the other supportive fat soluble vitamins. So between a breastfed and bottle fed child, whilst breastfed is potentially better, I'm still seeing these issues in breastfed kids because we're a population with vitamin D deficient. So and we still get the functional issues sometimes in breastfed kids as well. They actually develop even a forward tongue posture when they're breastfed, and sometimes a bit surprising actually because the mother's surprised. They said, oh, they breastfed for 2 or 3 years, and they still have these. So there's a compensatory thing happening. If the mother is vitamin D deficient, which nearly a lot are, and that passes to the kid, we're still seeing these issues in both breast and bottle feds. However, bottle fed kids certainly can have more severe versions. You can tell, for instance, any oromotor function, so thumb sucking. For instance, you can see that you'll see a bite that doesn't connect; the teeth don't meet, and you get an open bite at the front. And then bottle fed kids will sometimes have the tongue thrust swallow, so their tongue will poke forward when they swallow instead of going up and back. So there are patterns, but look, overall, this is happening across the population. It's a whole system we need to fix, and even unfortunately, breastfed kids are still experiencing this because you're not going to see across the board good craniofacial growth just from breastfeeding. There's many factors. So it's a great question. I think that overall, there's certainly we need to be getting back to breastfeeding and supporting women to breastfeed, but we also need them to support their nutrient systems as well. Okay, great questions here today. So look, there's a few professionals here in the it's great when people kind of, because obviously we try and answer all the questions, but in my practice we always take other perspectives and refer to other specialists, and we want a multidisciplinary approach to this, and that's really the message of craniofacial growth development, is that it's a multi-specialist approach, and it's going to take a whole society to fix this problem, and we need a lot of people understanding it. So it's great, we've had chiropractors, we've had many other dentists and we talked about different systems, but it really takes that approach. So in the comments, there's lots of people that are switched on to this stuff. Ask questions and answer each other's questions, because they're the kind of things that I don't know everything, and no practitioner knows everything. So it's important to kind of draw from our community in that sense. How detrimental are dummies, pacifiers on babies, toddlers to craniofacial growth? So dummies are definitely an issue. Now, so I've got a 5-month-old, and so she would use a pacifier, very rarely when she's cranky in the evening, ready for bed. But generally, she doesn't use a pacifier, and doesn't really, she'll say that we want to do her afternoon nap. Will very rarely use a pacifier, but for the most part, for kids who use pacifiers all the time, it can create that open bite. So what they do, if especially a persistent pacifier use, 2, 3, 4, these are the kids that it will affect how their front teeth come in. And so what happens is that if they develop an open bite, their tongue will then go to the gap, and so it'll be a tongue thrust swallow, like we talked about before, very common. And then it's a difficult problem to fix. Well, actually, that's not true. Actually, it can be fixed as you can start using myofunctional guards. You can use chewing. You can use. There's lots of different ways you can do it. But once they hit that relationship, then you have to correct it. So and you see teenagers and you see adults with a bite like that, and that's a functional issue. It's the tongue going to the anterior space of the mouth, and really kind of interfering with how the teeth, because the teeth just listen to how the muscles and the bones are moving. So they're just going where they can, and pacifiers create an environment where there's an interference in the mouth, where we should be closed-lipped, we should be tongue to the roof of the mouth. Tongue to the roof of the mouth is really important. So it's preventing that. The one advantage of pacifier, the trade-up potential bit, is that at least the kid with the pacifier in is breathing through the nose. So there could be an argument there that kids that have the real open mouth posture, it might be better for them to use a pacifier for a certain amount of time, because at least they're breathing through the nose, and then you wean them off it. But it can be a little bit difficult weaning kids off dummies and pacifier, and yes, it can affect it. All right. Do you think a vegan diet can be sufficient for kids and adults in nutrients for growth, supplement, vitamin 3, D3, K2, B12, and omegas, considering a fresh, healthy, variable diet, of course? I think for kids especially, it's going to be very difficult. You've got a great set of supplements there. One thing I'd be definitely think is vitamin A, because vitamin A works especially with those nutrients. For kids, I would be very, I think it really depends on your genetic predisposition, your environmental. So if you're in the sun a lot, you can potentially get a lot of vitamin D. There's just not a lot of people that can do that anymore. Yeah, I would. So what I see in kids, right, is that kids that eat meat, most kids today eat meat, they're usually deficient. So I think if we were removing the animal products, remember, have these fat soluble vitamins. So I think it's going to be very, very difficult for a kid on a vegan diet to get enough of these nutrients. However, look, there might be people in certain environments that may, but for the most part, traditional societies, yeah, they need these nutrients. Okay, so lots of thanks everyone for joining us today. It's been we've had lots of questions. I did have look, we've covered a fair few of the questions. I did want to focus on craniofacial growth and development. There's a lot you can kind of tell. I've tried to kind of make it so you kind of get an introduction to all the different things, because for a system this complex, you have to be thinking on multi levels, right? It's the breathing, it's the posture, it's the sleep, it's the nutrients, and that's how we fix it. And you really it's not a one problem fix all, but as long as one thing I've really noticed, especially in the last kind of year or so, people are really switching on to this. And the numbers, for instance, that of sleep apnea, it's just with 1 billion people with sleep apnea, we really need to address this now. We can't have kids that are choking for oxygen in their sleep. Okay. My 9-year-old daughter is doing myofunctional orthodontics, but her lower jaw is still smaller and behind. Okay, so look, that's difficult to answer as such. Look, at 9, she's still got a lot of growth and development. So the thing about myofunctional ortho is that you kind of have to go with a bit. Yeah, look, it's not foolproof either. Some kids will need conventional ortho after myofunctional orthodontics, and that's not a failure as such. It's these things happen, but if a lower jaw is still small and behind, I would be thinking the tongue. She really needs to get that tongue posture up to the roof of the mouth. But there are other approaches as well. It really depends. It's hard to say exactly without seeing her case. All right. So look, I'll jump in the comments and see if we've missed anything. But I think overall, look, we covered a broad introduction to craniofacial growth and development. It's a really big area, and look, it's great. I really thank everyone that joined me today, because I think this is important. Us as cognizant, health aware adults, if we can get this into our everyday practice, we can change this for our children. And so, it's a difficult problem. So don't stress about understanding the whole thing. It took me a long time to understand it. But if we then start to work this into how our kids grow up, it's going to change. And so I'm really feeling that change happening and people becoming aware to the importance of it. So the fact that you're here, I thank you very much for that. And tell your friends about it. Tell people about, how this growth and development issue kids embrace it. They really need to be preventing this, because once we start this conversation, that starts a movement, and this movement has to happen in the human race, sooner rather than later. So thanks very much. I'll jump in the comments and try and answer any questions that I didn't get to. I really appreciate everyone being here, and leave any feedback, and look, we're going to try and do live interviews every week as well. So if you want a topic, or you have any questions, put them on the post, and we'll start a conversation from there. Thanks very much. Have a great weekend. Bye-bye.